Good day, everyone. My name is Mrs. Esther Ibrahim Tukur, a nurse practitioner, and I'm here to talk to us about self-breast examination. Self-breast examination is an examination that is carried out on the breast to create or to increase awareness of the breast of an individual. And so it is done, it's supposed to be carried out by women of childbearing age. Every woman that is of childbearing age should know how to perform self-breast examination by herself. Then, when do we carry out self-breast examination? The best time to carry out self-breast examination is after menstruation, after one's menstruation. When you have finished your menstruation, it's expected that at that time your breast is quiet, and so you will be able to examine your breast. Why we say the breast is quiet is because before menstruation, most women will complain of tingling sensation in their breast. Some women will complain of itching around their breast. Women will complain that their breast is a little bit heavier than what it used to be. And so after your menstruation, the breast at that moment will be quiet. So that is the best time to examine the breast. And when examining this breast, what are we looking out for? We are looking out for color of the skin. So before the examination, it means you would have known the color of your skin, of the skin around your breast. So you examine the color. If there is deviation from normal, you should be able to identify it. Sometimes you see hyperpigmentation, that the color becomes very, very light. It was normal before, but there are light patches around your breast skin. So it's something to go for further investigation. Or you see very dark patches around the skin of your breast, then you really need to go for further investigation. Then you also check for dimpling. The breast will now have a dimple. Sometimes you can see very light dimple, but sometimes it's a very deep dimple. That dimple wasn't there on the breast before, but now you are seeing a very deep dimple on your breast. Then you also need to go for further examination. Then you also see that there is thickness around the skin of your breast. The skin becomes very thick. The skin was normal, but now it's becoming very thick, and sometimes it becomes like the back of an orange, thick, and has very tiny dimpling, just like the way you know the back of an orange. That is how it is. So when you see these things, you also need to. Then sometimes you see discharge coming out from the nipple. Sometimes the discharge may not be dropping out of the nipple. You have to put a little pressure and press it to see. And when you are putting this pressure to see, what will you check out for? Sometimes you see clear fluid coming out of the nipple. Some people will see pus coming out from the nipple. Other people will see blood coming out from the nipple. And if you see these things, then it means that you need to go for further investigations. Then you also check for nipple inversion. Sometimes you have a protruded nipple. Your nipple is protruded, it's fine, it's protruded, but all of a sudden you find out that your nipple is getting inverted, is going inside, is getting inverted. Then you also need to go and see your doctor. Please, I want to encourage us, please, if you see any of these signs that I have mentioned, or these things that I have mentioned, if you see any of them, it is not for you to panic. It is for you to go for further investigation. There is no need to panic. It's not even every lump that you see on your breast that is cancerous. No. It's not every lump that you see. It's not every skin changes that you see. It's not every dimple that you see. It's not every inversion that you see that is breast cancer. No. It's for you to go for further investigation. And so don't panic, just be on your way to the hospital. Then what are the positions to assume when doing self-breast examination? The positions are, you can be in a lying position, you can be in a standing position. You remove your bra and then you stand in front of a mirror, then you palpate. Then another position is in a sitting position. Then you can also be in your bathroom when you are taking your bath. You can also palpate your breast. Those are the positions to assume when doing self-breast examination. Then